Hi, everyone. Thank you so much for being here today. My name is Alice Buenvenida. I'm a student physical therapist from Gannon University. My in service will focus on reactive visual stimulus training, or RVST, a growing tool in physical therapy that bridges cognitive and motor rehabilitation. Here are my learning objectives. By the end of this presentation, you'll be able to understand what RVST is and how it works, recognize its applications across patient populations from geriatrics to athletes, learn how to progressively integrate blaze pods into your plan of care, set measurable functional goals using objective data from RVST, and most importantly, use this information to support documentation, justify care, and advocate for our patients. RVST is a form of therapeutic training that uses visual stimuli, often in forms of lights or dynamic visual targets to elicit motor and cognitive responses. It's designed to enhance the integration of the visual, neurological, and the musculoskeletal systems to improve reaction time, motor control, and cognitive processing. So, how it works: when a light appears, the individual will see it, analyze what it means, and then respond by tapping, reaching, or stepping to the light. And this can help improve how fast someone can process information, make decisions, and move accurately. It's great for enhancing cognitive speed, selective attention, motor planning, reaction time, and dual task ability. RVST is used in physical therapy to improve how the brain and body work together. So, for older adults, it can help them react faster to prevent falls. Athletes sharpen their speed and focus. And patients who are recovering from a stroke, concussion, or brain injury, it can help them regain their coordination and thinking skills. It's also helpful for children who need to build their focus and motor control. So, as you can see, this is very valuable in physical therapy because it enhances neuroplasticity through sensory motor challenges. It supports functional outcomes like balance, safety, and coordination. And it can even be customized for high level athletes or low level geriatric patients. Here, I have listed common tools for RVST, and in my presentation today, I will be highlighting Blaze Pods. One of the biggest strengths of Blaze Pods is their versatility. They're not just for athletes or high performing patients. They can be completely customized to meet the needs of both lower level and higher level populations. In your geriatric and neuro rehab patients, we can set up a simple, low height pods and use dual task drills like standing balance while tapping lights. And this can improve reaction time, coordination, and help reduce the risk of falls. On the other hand, for post surgical or return to sport athletes, we can upscale the challenge by incorporating rapid stepping, multi directional reaches, or sport specific movements that challenge your cognitive and motor systems together. So, whether you're working with someone who's recovering from a stroke or someone who is returning to play, Blaze pods can be modified to provide the right intensity, the right target, and real time feedback, making them a powerful tool across the rehab spectrum. In these next two slides, I'd like to highlight Dr. Kevin Wilkes and his clinical contributions to RVST. He's a well known physical therapist and researcher whose work has advanced the return to sport protocols. He emphasizes that rehab should go beyond strength or time based milestones, instead, focusing on how athletes perform under real world cognitive and reactive demands. This first study, done by Dr. Kevin Wilkes and his colleagues, highlights the need to rethink how we assess readiness for return to play after an ACL injury. They argue that using just time based protocols are outdated and propose integrating neurocognitive and reactive drills into ACL rehabilitation. Importantly, They recommend using tools like blaze pods to set real world motor and cognitive demands like reaction time, decision making, and visual scanning, which are all essential for safe return to sport. And this supports the concept that RVST isn't just an add on, it's more of a complete way to evaluate functional readiness. This second study expands RSVT application to overhead athletes, such as those who are recovering from a shoulder or elbow injury. What's exciting here is that the authors provide reliability data with the intraclass correlation coefficient ranging from 0.57 to 0.82, showing these reactive upper extremity tests are consistent and measurable. And ultimately, it demonstrates how blaze pods and RSVT can be used in not just lower extremity rehab, but across different regions and return to play scenarios, always tying it back to functional readiness and safety. His research also includes reliability testing of blaze pods base drills in both closed and open kinetic chain positions, showing a strong consistency in reactive upper extremity assessments. These contributions supports a shift towards RVST as a vital tool for determining readiness, guiding progression, and making data-driven discharge decisions. This slide highlights a 2025 study that validated blaze pod stepping reaction tests in older adults. They found the test to be highly reliable with the intraclass correlation coefficient of 0.79. It correlated well with a standard balance assessment like a timed up and go. And on the left, you'll see a real example of what this test looks like in a clinical setting. It's a great example of how we can incorporate RVST in older adult rehab to safely challenge reaction time, improve balance, and ultimately reduce the risk of falls. What makes this so important is that it gives us objective, measurable data on reaction time in a population where it can be a life saving factor. It shows that RSVT isn't just for athletes. It can be highly effective in geriatric neuro rehab to reduce the risk of falls and improve functional mobility. So, now that we reviewed Dr. Wilk's research and his emphasis on neurocognitive and reactive return to play testing, I want to show you how this approach translates to real clinical progression. What you're seeing here is a simplified version of Dr. Wilk's control to chaos continuum, where it's adapted using blaze pods. This framework helps us gradually increase cognitive and physical demands of therapy, starting with structured, predictable tasks and progressing to complex real world stimulation. It's a great way to scale RVST from basic skill acquisition to sports specific or community level readiness, making sure that patients aren't just physically strong, but cognitively prepared to whatever comes next. So, from a motor learning perspective, level one reflects a closed environment, predictable, stable, ideal for beginners or lower level patients to focus on an initial skill acquisition. Level two, variables introduce increased task variability and a mild time constraints, promoting adaptability and the transition to associated learning stages. Level three, chaos stimulates open environments requiring patients to respond to unpredictable stimuli. This taps into dual tasking, contextual interference, and problem solving under cognitive load, aligning with the autonomous stage. This stage approach supports neuroplasticity and it prepares patients across the spectrum from post surgery to return to sport readiness by progressively challenging both motor and cognitive motor systems. This slide highlights how RVST directly supports core PT goals across populations. Whether we're trying to improve gait speed, reduce fall risk in older adults, or athletes increased reaction time. RVST provides a functional way to target those needs. The great part is how versatile the application can be. We can adjust the challenge to match the goal. For example, using blaze pods on a foam pad for balance in geriatrics, or incorporating reactive decisions in a sports specific stance for athletes. It's a great way to blend motor control, visual processing, and task relevance into something functional, helping us move beyond basic strengthening into tasks that matter every day for performance and safety. Once we've identified a functional goal, the next step is to making it measurable. Blaze Pods gives us objective metrics we can actually track, like reaction time, repetition count, and dual task accuracy. These data points allow us to set clear, time bound SMART goals. For example, patient will decrease average reaction time of 0.85 seconds to 0.65 in 3 weeks using Blaze Pods and standing tap drill balance. Or patient will complete 20 reps in 90% accuracy in a dual task drill to reduce falls risk in dynamic environments. These goals help guide treatment progression, support documentation, and boost patient motivation because progress becomes something that they can see and feel, and not just something we say. Ultimately, RVST gives us a way to bridge the gap between what patients do in clinic and how they function in real world. It allows us to target the brain and the body at the same time, collecting meaningful data and shaping and shape our care in ways that are not only effective but defensible, documentable, and patient centered. So whether it's helping an older adult stay independent or helping an athlete return to play, RSVT empowers us to be both creative and evidence based. Thank you so much for your time. I hope this inspired some ideas for how you might use this in your own practice. Thank you.